No showers.
All right, thanks, Grant. So when we get behind the wheel, we take safety steps to avoid a car crash, right? We all do that. We set our seat and mirrors in the safest position, and we buckle up before we even take off. So why don't we just take as much care with our heart?
Haley Smith live at the Intermountain Heart Institute this morning, showing us how we can identify some of these signs and symptoms before they become a problem. Good morning, Haley.
Good morning, and yes, that is key, is being able to identify those symptoms right from the get-go to make sure you have the best odds of survival if you do experience a heart attack. We've got Dr. Brent Muhlestein here.
Good morning.
Good morning. Okay, so we have been talking about the symptoms of a heart attack and how to be able to identify those. What are the three main things people need to look for when they start to feel something that's a little abnormal?
Well, the first thing to remember is you will get some sort of discomfort. A lot of people refuse to call it pain, but it's some sort of discomfort. Oftentimes, it's somewhat localized right around here, and sometimes people will say, well, it hurts, and they'll ball up their fist and put it right here.
So that's a good identifier, is balling
yeah,
up
if they
your fist.
do that. Sometimes they also describe it like it's an elephant standing on your chest, and you just get this sense of pressure. And then sometimes it radiates down the arm, up into the jaw, and sometimes even in the back.
So it will go up into your jaw.
Sometimes it'll go up a bit.
Okay, and up the side of the neck there?
And up the side of the neck, but not always.
Okay.
And so if it doesn't do something exactly like I say, that doesn't mean it's not a heart attack. The other thing that sometimes happens is people break out into a cold sweat, and they they're not really hot or anything, but they have this cold sweat.
Okay.
And those things together oftentimes are characteristic. The final thing that's often very characteristic of the three is that people really take this seriously. They have a sense of impending doom, like they're about going to die. And oftentimes that's probably true. And so nobody takes this like comes in and says, oh, I've got 10 out of 10 chest pain, but it doesn't, where's something to eat or something. They never do that. They just sit there oftentimes just stock still with their hands and fists against themselves, just absolutely terrified.
And now
so
one
those
thing
are the three
to mention,
things.
though, is that oftentimes women, although they might have those same side effects, they treat them differently or don't recognize them.
That's right. Sometimes women, we call it atypical pains, in which it doesn't really have like a pressure sensation. And so, especially if women develop other sorts of symptoms that don't feel right, even if it doesn't sound or feel exactly like we're describing, they need to think about a heart attack, because more women die of heart attacks than almost anything else, although oftentimes they do it a little bit later. And so they therefore need to understand that heart disease happens in women as well.
Dr. Brent Muhlestein, thank you so much. You guys, coming up in 30 minutes, we are going to put what a real heart attack looks like here on these screens, show you what that's like and what doctors do here for treatment. Andrew and Lori.
All right, Haley, some really good advice and symptoms of what a heart attack is, because it's confusing, because men and women's symptoms very different.
And can be scary, but also